During the first stage of labor, the intrauterine pressure is increased up to 40-50 mm of Hg. Which of the following are screening tests for cervical cancer? Pap test, HPV DNA test, visual inspection with acetic acid. Heavy menstrual bleeding is a common presentation in which of the following? Clotting factor deficiency, fibroid uterus, adenomyosis. Serum level of Ca-125 is raised in which of the following conditions? Epithelial ovarian cancer, endometriosis, pelvic inflammatory disease. Uterus is supported by pubocervical ligament, cardinal ligament, uterosacral ligament. Amongst the following, pulse index is highest with calendar rhythm method. Following vaginal delivery, uterus become non-pregnant size by 6 weeks postpartum. Indications and prerequisites for delivery with the venatose include delay in the second stage of labor, non-reassuring fetal heart rate, vertex presentation. Which of the following fetal infections are associated with significant intrauterine growth restriction? Cytomegalovirus infection, rubella infection, toxoplasmosis. Missed abortion is not diagnosed if USG shows fetus with cardiac activity. As per the PC and PNDT Act, permission will be given to perform the tests for detection of which of the following? Chromosomal abnormalities, hemoglobinopathies, sex-linked genetic diseases. Which of the following are indication for early clamping of umbilical cord at delivery? RH incompatibility, baby born to a diabetic mother, birth asphyxia. The definition of gestational hypertension includes sustained rise of blood pressure to 140 by 90 mm Hg on 2 occasions 4 or more hours apart. Pregnancy should be more than 20 weeks. A 27-year-old female is complaining of grayish-white discharge with fishy odor. There is no history of itching associated with discharge. Bacterial vaginosis. Which of the following are contraindications for insertion of intrauterine contraceptive device IUCD? Suspected pregnancy, acute pelvic infection, severe dysamenorrhea. Regarding the phenomena of lightning in primi gravida at term pregnancy, which one of the following statement is correct? It is a welcome sign since it indicates descent fetal head into pelvis. The first line treatment of group B streptococcus GBS infection in pregnancy is penicillin. Which of the following are included in combined prenatal screening test in first trimester? Beta HCG, natural translucency, PAPPA. Hyperemesis gravidarum. Wernicke's encephalopathy is seen due to deficiency of vitamin B1. Which of the following are correct regarding placental site trophoblastic tumor PSTT? Low serum beta HCG composed mainly of cytotrophoblast, local invasion into myometrium. Metroplasty is the surgical procedure done for which one of the following uterine anomalies? Septate uterus. Which of the following are effective in the management of premenstrual syndrome? Combined oral contraceptive pills, diuretics, hysterectomy with oophorectomy. Which one of the following blood test is the marker of ovarian reserve? Anti-Mullerian hormone. In the Palm-Cohen classification by FIGO for abnormal uterine bleeding, ovulatory dysfunction is the cause in which of the following condition? Polycystic ovarian syndrome. Which of the following are correct regarding genital warts? Condyloma acuminata. It is related to HPV type 6 and 11. It can be transmitted sexually. It can involve vagina and anus. Which of the following are correct regarding endometrial cancer? It is more common in white population. HNPCC. Hereditary non-polyposis colorectal cancer syndrome is a high risk factor. Adenocarcinoma is the commonest histopathology. The reference point 0 in POPQ, pelvic organ prolapse quantification classification is taken as Hyman. Which of the following are various treatment options for twin transfusion syndrome TTTS? Septostomy, laser photocoagulation, selective fetal reduction. Which of the following drugs should be avoided in laboring women with bronchial asthma? Opioid analgesics, prostaglandin F2 alpha, ergometrin. Complication of malaria in pregnancy, thrombocytopenia, hypoglycemia, disseminated intravascular coagulation. Which of the following are correct regarding drospirenol? It is a fourth generation progestin. It has anti-androgenic property. It has anti-mineralocorticoid action. Which of the following symptoms are related to ectopic pregnancy? Acute abdominal pain following amenorrhea, abdominal pain with bleeding PV, fainting attack with shoulder pain. Premenstrual syndrome (PMS) should fulfill which of the following criteria? It is not related to any organic lesion. It regularly occurs during the luteal phase and each ovulatory menstrual cycle. Symptoms must be severe enough to disturb the lifestyle of woman and seeks medical help. Which of the following statements are correct regarding constriction ring? Premature rupture of membranes is a high risk factor. It is situated at the junction of upper and lower uterine segment. Uterus never ruptured. A patient delivered a live healthy baby 4 hours back. Now she has developed persistent severe pain in the perineal region and rectal tenesmus. Local examination reveals a tense and tender purple swelling at the vulva. What is her probable diagnosis? Pelvic hematoma. Which of the following are included in the management of cord prolapse during delivery? Knee chest position of the patient, preferably cesarean delivery, lifting up the presenting part of the cord. Which of the following statements have obstetric significance at the level of plane of least pelvic dimensions? It is a landmark used for pudendal nerve block analgesia. Deep transverse arrest usually occurs at this plane. It is at this plane that the internal rotation of the fetal head occurs during labor. Which surgery is most likely to disturb the paracervical nerve plexus, resulting in atonicity of the bladder? Radical hysterectomy. The patency of fallopian tubes can be clinically tested by which of the following methods? Sonosalpingogram, hysterosalpingogram, laparoscopic chromotubation.